see you there. My name's Jesse, and welcome to this segment of Phobias Revealed. Joining me today are some of my good friends from the Therapeutic Recreation Department at Mohawk College. Let's go join them. Hey guys, what's up?
Hey Jesse, how's it going?
Pretty good. You ready to learn about some phobias?
You betcha. I'm Vicky.
So Vicky, what are you going to talk to us about today?
I'm here today to talk about signs and symptoms of phobia. The DSM-5 identifies these signs and symptoms in various ways. The biggest one is anxiety, and this can be expressed in children through tantrums, or crying, or freezing or clinging. But most importantly, anxiety has something to do with the fear of an object or a situation. Now, when an individual has a phobia and has an anxiety attack, they're often afraid of what the object is. So there's either two things the person can do. They can avoid it, or they can endure it with great fear. This fear and anxiety typically lasts longer than 6 months, but the most important thing to know is that this fear or anxiety takes over the person's life. They're not able to go to school, sit on a bus, or run around outside without being provoked by their phobia.
Wow, that sucks.
I know. People who have phobias often get into panic-like states, or because of their phobia, they have PTSD. So that means once they're exposed to it, they get really stressed out, and more fear and anxiety can happen.
Wow.
Amazing stuff, isn't it?
It's very fascinating. Thank you so much for sharing this, Vicky.
Anytime, Jesse. I'm gonna listen to NSYNC on my Walkman.
I'm gonna go find Craig.
I'm Craig.
Hey Erica, have you seen Craig?
I think he's downstairs.
Sweet. Craig, are you down here? I think I hear him strumming some guitar. Ah, Craig, what's up?
Hey, Jesse.
Do you have anything interesting to tell us about phobias?
Have a seat. I got a lot to tell you actually about medications you can take for phobias and helping with the symptoms. There's antidepressants, or SSRIs according to Medscape.com, such as Prozac, Prozac Weekly, and Zoloft, that you can take to help your anxiety and panic disorders when you come in contact with the phobic object. And they also, though, they do have some side effects.
What are those?
Like nausea, fatigue, drowsiness.
Sounds like you have some of these symptoms, Craig.
There's another class of antidepressants called SNRIs, also from Medscape. The main one is Effexor XR, which helps prevent panic attacks and symptoms of anxiety and depression. But that too also has side effects like headaches, dry mouth, nausea, and dizziness as well. Yeah. There's another class. It's a really long word. It's called benzodiazepines. Now these ones you got to be careful with. They're not commonly prescribed to people with a long history of drug or alcohol abuse because of the tendency for it to develop an emotional dependence on the drug. So some of those drugs are Xanax and Ativan, which treat generalized anxiety disorders. But those also have side effects like diarrhea, nausea, headaches, and dizziness again.
Wow.
Yeah.
So they sound very similar.
Yeah, those ones you gotta be really careful with, man. One of the other classes on Medscape.com was anti-anxiety agents like Buspirone, which treats anxiety disorder and provides short-term relief of the symptoms of anxiety. However, it does cause some side effects like headaches, nausea, drowsiness, and nervousness.
How do you think those side effects affect the 5 areas of rec participation?
Well, if you don't feel well, the recreation participation is going to be decreased because you're not going to want to go to the programs or anything like that. And if you do end up going to the programs, agitation is going to be increased because you don't feel well. So doing something when you're not 100% is not going to always feel good.
Very well spoken, Craig.
Thank you. Can I finish my song?
I'll let you get back to your song.
I'm Erica!
So, Erica, what have you brought to talk to us about today?
talk to you about the 5 different types of phobias.
There are 5?
You betcha.
Wow.
The first type of phobia is animals, so anything to do with animals or insects, like cynophobia, which is the fear of dogs.
But I love dogs.
Well, then you don't have that phobia.
Okay.
Or ornithophobia, the fear of birds.
Oh.
The second type of phobia is natural environment, which means anything to do outdoors. Earthquakes, heights, thunderstorms, stuff like that.
Everyone hates thunderstorms.
Not everyone.
I do.
The third type of phobia is blood injection, which means anything to do with giving blood or having to get a needle. So that could be hemophobia, which is the fear of blood, or trypanophobia, which is the fear of injections. The fourth type of phobia is situational, which means that certain people are scared of certain situations, like aerophobia, the fear of flying, or claustrophobia, the fear of smaller confined spaces. The last type of phobia is other types, so stuff like fear of choking and vomiting, like nosophobia, which is the fear of illness.
That's great. Thanks so much, Erica. Now let's go and talk to our friend Gordon about phobias.
I'm Gordon.
Hey Gordon, what's up?
Hey, Jesse.
Cool.
Yeah.
What did you bring to talk to us about?
Actually, today, I'm going to let you guys know about the one axis that phobias fall under, and that's the first axis out of 5. And I learned this from the DSM textbook, 4th edition, one book I actually read.
Hey.
So the reason it's in the first axis is because it represents acute symptoms. So people who are placed in axis 1 have commonly known disorders, such as major depressive, schizophrenic episodes, or panic attacks. Panic attacks fall closely with phobias, because when somebody encounters their phobic object, they often have episodes or panic attacks.
All right. Thanks, Gordon.
No problem, dude. Catch you later, man.
For sure. So now they're all sitting together. Where do you guys think that you could encounter these individuals in your field? Vicky.
A long-term care home.
That's a good answer. Oh, Gordon has one.
Adult day programs.
That's excellent. Craig, yeah?
Hospital.
Okay.
What about group homes?
That is a very good answer as well. And in all of these facilities that you guys suggested, the TR is going to have to do more one-on-one programming with the client to get their needs met, right?
Right? Yeah.
Awesome. So why don't we all try to come up with each of us a phobia and try to care plan around it as the TR.
What about cynophobia, which is the fear of dogs? You could work on increasing their comfort level around the topic of dogs. So you could start with like a general discussion about dogs and then move up to like plush toys and beanie babies and stuff. And then maybe, you
I
know,
love Beanie
sometime
Babies.
down in the future when they develop like stuff where they can make like robotic dogs.
Future.
That's like in 2 years' time, bro.
That's like
Yeah.
2016.
Like that would be pretty cool too. And then, you know, eventually bringing in like a real small dog and then like moving it all the way up to like a larger dog. That'd probably work.
That sounds
A
like
lap-sitting dog and then a big, huge, like, Great Dane.
Yeah.
I have one. It's called melissophobia. So that's the fear of bees. So this program would use integrative therapeutic methods to help avert the clients from their fear. Okay, so the first day in the program, they would watch a movie about bees and their importance in our ecosystem. Because as we know, bees are important.
Of course.
Am I right?
Yep.
Yeah.
Yeah.
True.
So then after that, a beekeeper would come in and sit down with the clients and talk about, you know, more importance about the bees, but also tips and methods to calm their nerves around them. He'd also bring in a honeycomb for them to touch.
excellent.
Yeah, and throughout the program, people would discuss their fears and maybe post-traumatic moments that they had with the insects. And then finally, the goal would be to take the clients to a bee farm and have them feel safe and secure.
I've got one. How about pharmacophobia? So that's the fear of pills and medication. So we could develop a program where a medical professional comes in and then he could teach them like the harmless reality of medication. We could start off with something small like flu or cold medicine, and you could explain like methods of taking it, like with applesauce or pudding, stuff like that. And you could work your way up, educating them on more serious medication, and maybe hopefully that could, help them lower their fear. Right?
Soften the blow.
And then, we could explain like the use of pill crushers, stuff like that, and maybe even get like placebos into effect and try using those if they're interested.
Great thinking.
He's smart.
What if we come up with a program for people who have dentophobia? So a fear of going to the dentist.
It's a good program.
I've never heard of that before.
Yeah, so in the beginning, we would just be mindful of what our body is doing and reacting when we have thoughts of going to the dentist or being in the dentist environment. And then we can come up with effective coping strategies for when we are at the dentist. Because we know it's not healthy to avoid the dentist. We have to go, especially if we have an oral issue. So that's what we would work on in our program.
Those are all really good ideas, guys. I was thinking something along the lines of agoraphobia, or the fear of social settings.
Oh, cool.
So you could do like a little sit-down talk one-on-one and find out why the person has agoraphobia, what happened in their past. And maybe down the road in the future, if they invent like virtual reality, you could put them in front of a TV screen and have them visually see a group of people interacting with one another. It could be called Skype.
They'll never do that. That's a dumb move.
Okay. And then, forgetting virtual reality after that, you could go and do it in a real group. You could immerse the person in a small group of 2 or less, and then keep adding people as you go along the weeks. And then move them from a small group when they're comfortable to a large group. And then when they're in a large group, add more people until they're comfortable.
Awesome.
Nice.
Sounds great.
Right? I want to thank each and every one of you for coming on our show and talking about this important matter. See you next episode.
See you on the flip side.
Catch you later, alligator.
Bye.
Peace out, Girl Scout.
California, California, here we come.
Breast by children through.
I have a lot of interesting things to tell them.
Trypanophobia, which is the fear of injections.
My dad has that one.
Oh, yeah. The fourth one, like homophobia, fear of blood. Homophobia, homophobia. Fear of blood.
Sounds like something else.
When somebody experiences or encounters their phobic object. I was so close.
That sounds
A
like
lap-sitting dog and then a big, huge, like, Great Dane.
Yeah.
It's like, Great Dane.
We would start off by watching a bee movie. Now, not